Most people never think twice about their morning shower routine. It's automatic, comforting, a way to wake up and start the day. But in countries like Japan, where researchers have studied the phenomenon extensively, winter bathroom deaths number in the thousands annually. They've termed this heat shock, and while it hasn't received comparable attention in Western medicine, the physiology is universal and the risk is real. Understanding what happens to your cardiovascular system during that routine morning shower can be life-saving. The scenario plays out like this. You wake up in a relatively cool bedroom. Your body temperature is at its daily low point. Your blood pressure is beginning to rise as part of the morning cortisol surge. You walk to a cold bathroom. Many homes don't heat bathrooms to the same degree as bedrooms. The cold air triggers immediate vasoconstriction to preserve core temperature. Your blood pressure spikes. Then you step into a hot shower. The hot water hitting your skin causes sudden peripheral vasodilation. Blood vessels at the skin surface open wide to release heat. Blood pressure can drop precipitously. This is a massive vascular stress, going from profound constriction to sudden dilation within seconds. For someone with coronary artery disease, even if they've never had symptoms, this vascular whiplash can be catastrophic. The blood pressure surge during cold exposure can rupture vulnerable plaques. The subsequent drop in pressure during hot showering can reduce coronary perfusion, starving the heart muscle of oxygen. If the person has autonomic dysfunction, which is common with diabetes, aging, or certain medications, the blood pressure regulation becomes even more unstable. The result can be cardiac arrhythmias, myocardial infarction, or syncope. The syncope, fainting, deserves special attention because it creates secondary injury risk. Bathrooms are small, enclosed spaces filled with hard surfaces, porcelain, tile, glass. Losing consciousness in a bathroom frequently results in traumatic injury, head trauma, lacerations, fractures. For an elderly person, a fall in the bathroom can be immediately fatal or lead to complications that prove fatal weeks later. The combination of primary cardiovascular events and secondary traumatic injury makes bathrooms genuinely dangerous spaces during winter months. The enclosed space creates additional problems. Hot water generates steam, which in an inadequately ventilated bathroom increases humidity to near saturation levels. This can trigger bronchospasm in people with asthma or chronic obstructive pulmonary disease. The warm, humid air also means less oxygen per breath compared to cool, dry air. For someone with limited cardiac or pulmonary reserve, this subtle reduction in oxygen availability can tip them into crisis. So what's the solution? You can't simply stop bathing. The Japanese experience offers practical guidance because they've worked on this problem systematically. First, pre-warm the bathroom. A small space heater running for 15 minutes before showering can raise the temperature enough to prevent that initial cold shock. Second, moderate water temperature. Extremely hot showers feel wonderful but create more vascular stress. Warm rather than hot water is safer. Third, transition gradually. Don't immediately stand under hot spray. Start with warm water and increase temperature slowly. Fourth, ventilation matters. Run the exhaust fan or crack a window to prevent excessive humidity buildup. Timing is another consideration. Remember that morning hours carry peak cardiovascular risk. Evening showers occur during lower-risk time windows and might be safer for those with cardiovascular disease. For elderly individuals or those with known heart conditions, having someone nearby during showering, even just in the adjacent room, means help is immediately available if something goes wrong. Installing grab bars isn't just about fall prevention for mobility issues, it's about having something to hold during dizzy spells or chest discomfort. Finally, recognizing symptoms early, chest pressure, shortness of breath, lightheadedness during showering should prompt immediately turning off the water, sitting down, and calling for help. The shower can wait, your cardiovascular system cannot.